Good afternoon. It's indeed a pleasure to be here with all of you today, because essentially for two reasons. One is that I love India. My father sometimes asks me, why do you love India so much? And the second one is that I'm passionate about improving healthcare access in India. What is COIS? COIS, we have an asset management arm and an innovative social finance, where we structure social impact bonds, development impact bonds in healthcare, amongst others. And the two activities that I really focus on most are private equity investments. One is in partnership with ILFS, is a fund out of which we did 3 healthcare investments, one in a maternal care chain in Bangalore, one in a radiotherapy manufacturer in Bangalore as well, and then one is a diagnostics company focused on fertility and cancer, and then Healthquad. Healthquad is a phenomenal fund. We have invested in companies that were very, very early stage, some a bit more mature. That's a partnership coming from a partnership between COIS and Quadria. And you heard Dr. Pinak from Healthquad here before, who heads our fantastic team. Healthquad has a global understanding about healthcare, and I've been asked to talk to you about the past, present, and future of healthcare. So luckily that Ashwin said that truth and its opposite were still the truth, because it's quite a broad subject. Then Indian healthcare landscape, and then what are we looking for when we look at companies in that space. So what are the two biggest disruptors in our healthcare industry globally? Well, it's first of all the fact that genomic data and computing speed have seen exponential growth in the last 15 years. That's obviously what's opened the door to AI, and that's what's there to radically change an entire industry that has been actually quite static for the last 20 years. And that, combined with the cost of decoding the genome, that has dropped like a stone. And the combination of both are what I think is currently changing the face of our healthcare industry. Now, if we go back to looking at healthcare more as a global market, well, we see that even if it is growing quite strongly, it is supported by increasing population, aging population, lengthening life expectancy, increase in chronic diseases, increase in disposal income, and finally, technology innovation. Now, if, sorry, I'm having a slight problem with, where I don't know where I should aim in order to get the, now if we look where does most of the growth come from, most of the growth, that 6% global growth, it's really very much coming from Asia. And so that's a first good reason for you to be in this room rather than being in Silicon Valley today. It's because growth is really happening here more than anywhere else in the world. Now, what are the major issues that are being faced with? I mean, there's on one hand the funding crunch, which is really dramatic. And particularly in the US, particularly in Europe, more than 15% of GDP being invested in healthcare is not sustainable. Regulatory challenges are really quite strong, and a lot of you here, I understand, are techies and entrepreneurs, but not necessarily with a healthcare background. And that's one thing you really want to make sure you don't get wrong, is that you perfectly understand the regulatory space you operate in. Changing demographics, these are really having a tremendous impact on the care equation. The lack of manpower is stronger here than in any part of the world, but it's the same in nearly all developing economies. And then accessibility is one that here in India we know well, since 600 million people don't have access to healthcare. One of the reasons for that lack of accessibility is the shortage of beds, and that obviously has boomed as an economic proposition in the last 15 years, particularly the tertiary care industry that was heavily PE backed, and now some more innovative secondary care models have cropped up, or single specialty models addressing part of that need. And then if we look at the macro picture, again, we see that that funding issue is a real issue. And while in mature economies it's the government who dishes out the money, here obviously we know that it's consumers, but again, it's that ability to pay and that ability to fund that is a cause of major issues for individuals, dragging them into poverty. So the question everywhere, more today than ever, is how can we improve dramatically healthcare outcomes while reducing costs fantastically? And if some of you have the solution for that, and that you can trace the money, such as was discussed earlier on, that's bound to be a winning enterprise. Now, what are the big models undergoing transition? Well, we were used to a very paper-based traditional healthcare model in which there were very, very few changes going on. And I did spend the first 10 years of my healthcare career working for a pharma company, and the models everyone was working with were extraordinarily static and similar. And suddenly all my pharma peers that I see are all telling to me about their latest digital innovation in marketing or in R&D. So they are just extremely hungry to be able to prove to their bosses that they are taking part in that disruption. Then it was a totally physician-centric, and we've heard earlier on that more and more who have succeeded is because they managed to put the patient in the center of the equation as well, and digitization is obviously a tremendous tool to do that. It was an independent choice, and now it's an integrated platform, and there was opacity, and hopefully we are going to a model that is much more trust-based. Now, some of the changing preferences that we are seeing at Healthquad and that we're really looking for is that patients and that have to be addressed is the patients bearing of a growing share of the cost, that they are progressively owning the responsibilities, that they want more transparency, and that they want new ways to engage in their health. That's a slow trend. I think that there was some in the previous panel, some differences between Indian and Silicon Valley views, and I do think that there is a difference in speed of change of the American consumer versus the Indian healthcare consumer. And so while the American consumer may move faster in changing his or her healthcare habits, if you are an entrepreneur who's facilitating all these trends in India, but that you're not benefiting from regulation, neither generating any rupee saving for anyone, you better be careful because you could be burning a lot of money for a very long time. So what are payers looking for? They're really facing increased budget and margin pressure everywhere. They're exploring new business models, really extraordinary. I was negotiating with a UK payer not so long ago, and he told me, well, last week we were in China and we were comparing our payer models innovations with the Chinese government and talking about what the Brazilians were doing, and we therefore wonder if we shouldn't be fixing the price for your drug according to this and that matrix. So what that suggests is that the payers really do sense that crisis and that they're all exchanging ideas in a very rapid and open manner. There's implementing value-based reimbursement. It's obviously slower in some parts of the world where there is lower insurance and lower government involvement, and then increased focus on aggressively managing drug costs. So the healthcare systems and the physicians, I think we've spoken quite a bit about these, and for the sake of time, I'll jump them now. What do we see? We see digitization obviously impacting the pre-treatment phase, the treatment phase, and the post-treatment phase, and we're quite agnostic to intervening in any of these. There are tremendous opportunities in any of those. Now, if we had to club those, probably we would say that some are about behavioral shift, the need for better and healthier lifestyle, to really own more of your healthcare choices and to be more proactive about them, and where you as entrepreneurs are basically helping that happen. The other one is really to empower the consumer, and that can be done via healthcare analytics, aggregator models, convenient shopping, incentivized wellness, do-it-yourself diagnostics, social support communities, or incremental and affordable health. And we think that all these some of them are going to fail, but some entrepreneurs in this space are going to make that become great changes. Orchestrated approach, or really personalized and distributed model of care, or analytical tools to help doctors, these are going to make big changes as well, such as augmented treatment. So what are examples of these? These are remote house calls. These could be cloud-powered medical records, physician-to-physician networks, data-driven treatment plans, embedded vital monitors, or printed procedures. All of these, we think, really have their space, and there's a need for them here in India. So has that been done? Can that be done? We all know of Aravind Eye Care, and it's just stunning results, both from a cost and a quality of care perspective. And this is really a first slide that, in my eyes, confirms the fact that it's much, much cooler, much more important for humanity to be in this room rather than in a more glitzy room in San Francisco. Why? Because if you can replicate that again and again in other domains, as we spoke about in the last 10 minutes, there is a demand for low-cost healthcare all over the world. Everyone wants to be applying what Aravind is doing in Europe to reduce the cost of healthcare in Europe, same in the US. And most importantly, while you're doing that here, you're going to make the other 5 billion people on the globe who don't have access to healthcare having access to healthcare. So on one case, it's a real economic case. At the same time, it's a deeply humanistic case. So as Healthquad investors, what do we want to find in the companies we back? We want to get close to the patients and follow their established behavior patterns. We want to reinvent the delivery model by using proven technologies but disruptively. We want to confront professional assumptions and right skilled workforce. We also want to standardize operating procedures wherever, go after asset-light models, and finally, open new revenue streams across sectors. So if your company has one of these characteristics, please come and talk to Dr. Pinnack and me after the talk. So what are the big macro trends, just as a summary? So unsustainably high healthcare expenditures, be it for payers, for governments, even for individuals, increasingly regulatory challenges, expanding healthcare digital availability and transparency, and then changing roles and interrelationships of healthcare stakeholders. And finally, growing use of lower cost treatment alternatives. So that's a bit to wrap up on the global space. And why is the Indian healthcare landscape so important? Well, on one hand, it is extremely fast growing, one of the fastest in the world. Then it basically needs to triple the infrastructure that's there in terms of beds, in terms of doctors, and the investments required are just gigantic. So it's unlikely that in that short period of time, those number of beds and doctors be added. So there is a huge need for other ways to bridge that gap, and innovation, entrepreneurship, and technology are probably a large part of that answer. Can you move the slide forward, because this is not working. So you all know about accessibility, affordability, and quality. So inadequate healthcare infrastructure, need for more trained human resources, poor availability, burden care, very, very poor insurance coverage, and then poor healthcare indices. I mean, as a summary, what does that mean? It means that there's roughly 600 million Indians, as we know, who don't have access to modern quality care. But at the same time, there's no better place in the world to find the solutions for the private sector to make these 600 million have access to modern healthcare very fast, in a profitable manner, and in a manner that can be brought to the 5 other billion humans who don't have access to quality and modern healthcare today. So what each and every one of you are working on, dreaming about, sweating about day and night is absolutely fundamental. I think that I don't know precisely what each and every one of you are doing, but there is no better place to be on the globe than India today in order to solve this issue. There is no issue that is more purposeful and more important for humanity, and there is none that is more economically attractive, because people want to have a healthy family, and they will pay for it if you make a change. And what you invent here in India will be exported around a large part of the world, and maybe even come back as a loop to the West, where they want to reduce costs. So do keep at it, however hard it may be. Healthquad is a healthcare-focused venture capital fund with very deep sectorial expertise. We have several doctors in our teams, we have entrepreneurs in our teams, we have a very long-term healthcare bankers, professionals, and VCs and PEs. We focus on healthcare delivery, life sciences, devices and technology, health IT, and ancillary health services. We think that we really provide true business expertise, and that we can help companies scale like no other. What is there in our portfolio? why have we chosen these companies? We've invested in Regency Healthcare and brought IFC to invest aside of us in the largest hospital care chain in UP. Basically, they serve 270,000 patients a year. They were founded by a remarkable doctor who, on the day where he was going to end his neurosurgery at Ames and become an academic professor at Ames, thought that he would rather influence healthcare by going back to his own town and build a hospital that was based purely on quality of care and granting no cuts to anyone in the system. For 8 years, he accumulated debts and losses, and then finally, patients turned around and noticed the quality that he was offering to them. So we have also backed Neurosynaptic. You heard Samir this morning. Samir is a remarkable case. He's been literally biting rural India's dust for the last 7 years. He could have been a comfortable engineer in very pleasant surroundings, and he decided that he wanted to make sure that his technology and his passion were there to improve rural healthcare, and it has literally changed the lives of more than 2,000 villages so far, and we're quite excited to see the model scale now and go well beyond its original approach with the new software as a service that we've managed to develop with them and grow in new sectors and new market opportunities here in India and abroad. Asian Institute of Nephrology and Neurology was founded by an extraordinary nephrologist. He was head of nephrology at NH and basically wanted to build the NH of nephrology and neurology, and he managed to build a system that is not only producing remarkably good health outcomes, a bit like Aravind, but in a particularly low capex and low opex model that for investors is extremely attractive. And then finally, high impact consultants who work on staffing and employing people who are doctors and who are in tremendous need around the country, so that the entrepreneurs or the hospitals who are growing can find the talent they need. So these are the companies we've backed so far, more to come, and some that are in some of the spaces we spoke about early are in our due diligences right now. And we'd love to talk with more of you, more of your peers, and bring the value that we hope that you'll see us deliver for you in the coming decade. Thank you.